Northern Light Health provides care to thousands of Mainers with dozens of locations all across the state.
However, since last year, the company has announced the closure of 3 facilities, the latest one in Dexter. News Center Maine's Christian Harsa has more on how this will impact patients in the area.
In the small town of Dexter is one of Northern Light's internal medicine facilities. But with the recent impending closure of the facility in the fall, town manager Trampus King says his citizens are concerned.
Older residents who've been going there for years and decades, they're the ones that are most upset, and I don't blame them. Now they got to travel.
According to a statement from Northern Light Health, the decision was made because of an aging building and large costs to repair. Leaders say despite efforts to find a new location in Dexter, they were unable to find one. Patients will be able to receive care at any Northern Light facility. There are 7 locations within a 25-mile radius, but for University of Southern Maine Senior Research Associate of Rural Healthcare, John Gale, the added distance can be a burden on a patient.
So what it likely means is that either they're going to have to just absorb the burden of travel, or perhaps they may see their provider less.
King says the facility serves about 1,400 patients. One of them is Herb Greenberg, who turns 90 in 2 months. He feels fortunate to still drive and be mobile, knowing that not all are so fortunate.
So it's a tough scene for a lot of people.
Senators Suzanne Collins and Angus King announced this week $500,000 to Bristol Rural Health Care. Gale feels telehealth efforts may be a good investment.
There are still times when you really need to see a patient. But if you're doing a follow-up on a medication, for example, can you use telehealth to do that in a way that they may not be using now?
Northern Light will be closing its Dexter location September 30th. In Dexter, Christian Harsa, News Center, Maine.
And officials with Northern Light Health say they are ready to help patients transition if they wish to find care outside of their system.